All right, good afternoon and welcome to this Translational Applications in Public Health lecture. This is a collaboration between the Institute for Public Health and Medicine and the Northwestern University Clinical and Translational Sciences Institute. My name is Nikki Wojtowicz and I'm the Executive Director of NewCats. I'd like to thank everybody for joining us, and during today's presentation, we ask that you use the Q&A function rather than the chat to submit any questions you might have, and we'll have plenty of time at the end of the presentation for questions and answers. So I'm really delighted to be joined by two of my colleagues from the Office of Government Relations. First, I'd like to introduce you to Jennifer Kunde. Jennifer was appointed the Interim Special Assistant to the President in January 2022 and is the department's Executive Director of Government Relations. She is also Northwestern's representative to the City of Chicago, managing all aspects of the university's interactions with elected officials and local community groups. Her work also includes managing governmental issues of concern to Northwestern, both at the state and federal levels, including liaison activities with legislative and executive agencies, encouraging funding for the university's research endeavors, and advocating higher education policy that benefits Northwestern students and faculty. She holds a Bachelor of Arts degree in Political Science from DePaul University. In addition, please let me welcome Caitlin Leach. Caitlin joined Northwestern University's Office of Government Relations in September 2016 and is a resident in the university's Washington, D.C. office. Her primary responsibilities include advocacy on research-related and regulatory matters before federal executive agencies and the U.S. Congress. Caitlin previously served as Director of Policy and Advocacy at Research America and as Senior Legislative Assistant to U.S. Representative Rush Holt. Caitlin has a bachelor's degree in political science and master's degree in government with a concentration in science policy, both from Johns Hopkins University. So welcome to Jennifer and Caitlin. I so enjoy working with your office, and I'm delighted that you both can speak to our group this afternoon. So welcome, and I will turn this over to you both.
Thank you so much, Nikki, and thank you, IFAM and NewCats, for giving us this opportunity to talk to everyone on a very important topic. We view this as a great honor to actually speak with you because all of you make our life and job easier when we go to Capitol Hill or Springfield or the halls of City Hall to talk about the amazing research and work that you all do for our local communities and the nation. So thank you for all that you do. Thought we would start out by just giving a brief overview of the office so we can go to the next slide. I thought it might be helpful to see the organization chart for our team. We are a unit of the Office of the President, so we report directly to President Schill. And I personally have an office in both Evanston and the City of Chicago. We have a Director of State Relations that manages our Springfield, Illinois portfolio, and then Caitlin, who you will hear from very shortly, leads our Washington, D.C. office, and we are lucky enough to have a two-person D.C. office, given all the issues that we have to cover, and as well as some assistance to help us manage our day-to-day operations. Next slide. So essentially, we work very closely and collaboratively with the president, provost, senior staff, deans that help us identify and set our federal, state, and local agendas. And we serve as the official university liaisons with all the elected officials in those locations. So we are actually all registered lobbyists as well. Next slide. This just covers our main mission, kind of broad categories that we focus on to preserve and protect Northwestern's tax status. And clearly, top priority is advising for increased research funding, student financial aid, and that can also include specific Northwestern projects and initiatives that we want to highlight to our elected officials. We try to influence governmental policies, and that's where you all can really be helpful with your research, and then achieve specific goals that may be identified by the president and his team. Next slide. So these are just some of the areas that we can be helpful as we talk about the great work and research that Northwestern produces. As I mentioned, we serve as the official university liaisons. We try to identify opportunities with Congress and the federal agencies, promoting Northwestern initiatives and research to those key stakeholders. And we do really work collaboratively with our colleagues, especially in Washington, D.C. We meet monthly with the Association of American Universities, which are the top research universities in the country. And separately, we meet monthly with the Big Ten. And then we have many different coalitions touching on NIH funding, tax policy, athletics, regulatory issues, you name it. There's probably a coalition that we work with to support our advocacy in Washington, D.C. And obviously, we also monitor specific pieces of legislation and any regulatory actions that might come out of the federal government and impact the university. Next slide. So again, just reiterating, we our day-to-day, we're maintaining our relationships with our elected officials. We have a lot of touch points with both the federal staff and their local staff here in the state. We like to keep them very informed of campus activities. So as you can imagine, the last month has been very focused on making sure our delegation understood the university's position on student encampments, tents, and protests. So that was a lot of what we've been doing the last month. We will organize events both on campus and on Capitol Hill with our members. We invite members to come to campus. We manage those invitations. And we are very happy to organize briefings either on Capitol Hill or locally on either the Evanston or Chicago campus to highlight important research and activities. And then, you know, in addition to our delegation, we're also responsible for the federal agencies. So we often work with our faculty if they're interested in meeting with, let's say, a DoD program officer, or Caitlin has organized visits to the White House for White House staff to meet with our folks and highlight Northwestern research. We can also facilitate and help if someone is interested in serving on a federal advisory committee. We can coordinate letters of support and identify opportunities that come through the Federal Register that you all might be interested in, and just identify those in the agencies that could be helpful to us if there are concerns over regulations or other opportunities that you might see arise. Slide. And finally, before I turn it over to Caitlin and kick off the meat of our presentation, I just really want to convey that your work is critical to our mission, and it's your research that really helps us tell the story of Northwestern. And it's vitally important that you tell that story. So while we're happy to talk to our elected officials every day, it's really great when we can have you or your students, postdocs, come and actually talk about the work that you're doing and the importance to our country. And really now, Congress really needs to understand the value of basic research. And there's so much divisiveness in Congress right now, but I think, you know, turning back to the good work that Northwestern produces and talking about our research and our students is one of the best things that we can do to hopefully change hearts and minds in Congress and keep those budgets at a level that supports your work. And it's just so critical as well that you can be a voice for your patients and your local community groups as well. You're really an important voice. So with that, I think just hand it off to Caitlin.
Thank you, Jennifer, and thank you, Nikki, for that introduction to help focus this conversation. So I will, I guess, before I flip to that, I will go through sort of how to, hopefully we can talk through how to translate your research into policy. To ground that conversation, I'm going to go through some status updates of sort of where we are as it relates to research funding and sort of both perception and reality. So normally I wouldn't start with the fact that people think that the US government funding science and research is valuable, but we're as Jennifer alluded to, we are at a very divisive time here in Washington. So we do actually have to go back to the very foundational principles here that I'm glad to report Pew, this is as recent as late fall last year, is still measuring this, that Americans do think that there is value in the US government investing in science and research. And this really is sort of a dialogue, especially after the last few years when we think about trust and voices. And you all are in positions, I think, that are really valuable, as Jennifer said, to tell the story, to kind of connect some of these dots between the federal government funding research and then all of the society and Americans who benefit from it. So we really do rely on you and your voices, and they really are trusted still, even after the last few years, and even despite the really strong divides that we see every day here in Washington. I hope that you keep that in mind as you think about how you might engage federally with policymakers. And then to talk about budgets, just to give you a sense, this slide shows federal research and development funding as a share of the federal budget. So this is, you can see the different colors are different federal agencies. I did just a selection that I thought might be relevant to IFAM and to NUCATS, but NSF, NIH, DOE, DOD. When you look at those all combined, it's barely 1% of the total federal budget. So we're not talking about a huge portion of federal spending, despite the narrative I get every day when I advocate for NIH that $50+ billion is too much and that it's too hard of an ask to increase biomedical research funds. I think that we need to keep coming back to this to remind ourselves that it is both a small percentage of the federal budget and a declining percentage of the federal budget. So your advocacy, whether you're thinking about translating your research findings into policy, or you're just thinking about federal funding for your research, is really, really important, because this, while $50 billion for the NIH budget does seem like a lot, when we look at the big picture of what our federal government is appropriating each year, this is a really small share, and we want to make sure that these trends are either like in the case of NIH, not declining, or in the case of these other agencies, sort of not stagnant, where they have been over the last 20 years, as this snapshot shows us. And more specifically, in this most recent fiscal year that was completed very behind schedule, FY24, you may have heard, you may have read some of these headlines when they came out earlier this year, that research funding really did not fare very well in this most recent budget. NIH was basically flat, as this headline indicates, and I'd be happy at the end to take any questions about kind of the nuances of the NIH budget. It was more or less flat. There were some programs, some of which I know receive funding here at Northwestern, that are funded through the Cures Act, which was a piece of legislation 10 years ago that is now winding down its funding. So there is a gulf that is more or less flat. And then NSF, for those who receive NSF funding, received a 5% cut. So you'll see this other headline, shocked and disappointed. We do anticipate that FY25, that's the fiscal year that should start in October 1st, be signed into law by the end of September, although it will most assuredly be delayed. We do expect that FY25 will be an equally difficult budget year, especially as it relates to science. So your voices and your advocacy, if we could implore you to engage in it, are so important and so needed, especially in this moment right now. We have also lost a lot of research champions. I'll probably talk most about NIH during this presentation, although I'm happy to answer questions about any research agencies that you might be thinking about in the Q&A section. But when it comes to NIH, it has always been sort of the most bipartisan, it has received the most bipartisan support of any of our research agencies. And while that is still true to some extent, we have lost a lot of bipartisan champions. A lot of Republicans in particular, who were longtime supporters of NIH, have retired or are retiring. And so a lot of what we are doing in collaboration with some of our association colleagues and other institutional colleagues is trying to build back supporters. So they need stories, and they need to hear from you to kind of convince them to support research. We are very lucky in the state of Illinois, but many of our, your peer colleagues, maybe who you collaborate with across other institutions in other states, might not have the same support of their, for example, Senator Durbin and their delegation that we enjoy. So you can always think about too, like how to reach other people, or potentially work with some of your colleagues elsewhere to share some information about why research is important and how it affects patients, and improves, society generally. I did mention timelines, so I'll just put this in here, and if we share slides, you can refer back to it. This is sort of an aspirational calendar. We never reach these dates lately, but when I talk later about how to translate your research into policy and how and when to advocate, I just include this to illustrate the point that the funding cycle truly is year-round at this point. Even if they do hit this calendar, which often is delayed, there is basically, no matter when you find time to advocate, there will be a relevant point in the sort of process or in the calendar that you can time your advocacy to. So it's never too late, or it's never a bad time to advocate. And this is just something that you can refer back to think about the many steps in the process that align to the calendar. So when we talk about translating our policy, I figured I'd start first with, or translating our research into policy. I thought I'd start with a few examples of the different ways that takes form, because there's many different ways that you can advocate and that you can impact what's happening here in Washington. And we are, though our office does cover all levels of government, we'll be focusing on the federal government in this presentation. But certainly we could field questions about state or local if you had those at the end as well. So one way that I think might be really relevant if you were to think about translating your research into policy is to basically to share your expertise, often which is nonpartisan, and to share your evidence to improve evidence-based policies. A recent example that is dated here is 2021, but is ongoing, is that an effort led by one of our members of the Illinois congressional delegation, Lauren Underwood, who is a nurse, comes from a healthcare background, and has really taken on the Black maternal health initiative as sort of one of her main focuses in Congress. Many of our colleagues who come from Feinberg have weighed in on these policies over the last few years, and we certainly, it's a good example of legislation that moves, that Congress is interested in. Certainly hasn't passed anything more recently, but when Democrats were in control of the House, a number of bills were passed into law, and even now that legislation isn't moving, authorizing legislation is initially moving, this is still a very active effort through the appropriations process. So there are still ways to get some influence here through, whether it's on the policy side, the authorizing legislation, or on funding for specific improvements. So this, to give you an example from FY24, that same bill that I was just referring to that cut and level kept NIH funding and cut NSF funding, you can see here that it also included $100 million in priorities aligned to the Momnibus, which is what the Black Maternal Health Initiative is called. You can see some examples here. So that money went to CDC for surveillance. Some of the money went to HRSA for screening and treatment for mental health. Some of the money went to HHS to help work with community-based organizations. So there are lots of different ways to think about whether it's actual federal policy or funding for local policies, or the implementation of data collection or other screening tools that we know we have the evidence to show would be really beneficial. So these are two ways you could maybe consider engaging. You could certainly engage with public comments as an expert in your field. These are two, not necessarily your representative samples, but just two that I know we've engaged on relatively recently. One from NIH about their strategic plan on data science, one about government-wide response to sort of research security threats. But every day there are opportunities like this to engage. There are times when Northwestern will submit our own comments as an institution, but many or more often, many times our faculty might submit something just in their own name as an expert, and that you are well within your, if that's of interest to you, we can certainly help give you our 2 cents if you want to reach out to our office to talk about these types of opportunities. But many times it's much more impactful to hear directly from those who are close to the issue, who might have comments that are relevant to the rulemaking process. You can certainly engage to shape research policy. So this was just one recent example about seeking input on terminology for clinical research. Mike Lauer's Open Mic blog is one such way to find all of these opportunities. But your voice is really important to shape the policy. And some people are already engaged in these efforts, but there is a lot of opportunity to do so if you're interested in engaging more with the federal agencies beyond just the funding calls maybe that you are often monitoring, I'm sure. Okay, so when you think about, those are some examples of goals, but we'll now walk through for the rest of the presentation kind of how to go about engaging with federal policymakers. So I walked through some of those examples as to give you some ideas to think about what might your goal be. So the first step I think would definitely be to shape sort of an idea of how do you want to engage? Are you just looking to increase funding for research? Are you looking to kind of share some of your research findings with policymakers so that they can incorporate that into their legislation, or perhaps fund improvements in the healthcare system, for example? Are you looking to improve the conduct of research through research policy changes? So once you've thought about your goal, and our office, again, throughout this is happy to help you shape your, what it is that you would like to do. And we can certainly help you think through that on a case-by-case basis. Then the next step I would say is to identify your audience. So who exactly is the right fit for this? If you want to comment on rulemaking, you're thinking about the executive agencies. If you want to seek federal funding for an initiative or for research, that's obviously talking to Congress and their staff. So there's lots of different folks that you might be directing your advocacy at, many of whom do not have a scientific background. I'm a good example of that. I used to work on the Hill from a very traditional political science background, and then worked in policy for my whole career. Certainly at times worked on research-related policies, and absolutely had to rely on outside advocates who were closer to the research and who were experts to share their perspectives, because without that, the policy will not be as productive or as beneficial to society without your input. And they definitely, staff and elected officials rely on you. So some of whom I think do it more formally than others, and some offices you might find have sort of a council of research experts that you might be able to join, and some it's just a very ad hoc experience to start to develop a relationship with staff and start to share your perspectives. And then, so once you've decided what your goal is and who you need to be speaking to achieve that goal, when you're thinking about crafting your message, we always recommend using as plain language as possible. And I don't suggest dumbing down your content, but just making sure that you don't have any unexplained technical terms. You're not using acronyms that folks might not necessarily be aware of. Typically, these are very highly educated audiences. They just probably don't share the exact same academic background that you do. So using sort of the sophisticated but simple language is really helpful in this case. Obviously, we know that you would probably want to bring data along with you, and that is important, and we do encourage that, but make sure that you are kind of sharing the story behind your data, or the story that your data tells, in order to kind of make make it more clear. I worked for a member of Congress who had a PhD, and even he, with a scientific background, always admitted that human beings make decisions based on stories and anecdotes. And so finding the marriage between your data and the story it tells, I think, is really helpful for policymakers and their staff. And absolutely, which I think IFAM and NUCATS are in the perfect position for, to make sure you underscore the human connection and the real world impact behind your research. Especially when we're in the biomedical space, I think that is easy to do, but just make sure that you include that kind of at the forefront, because that is what really at the end of the day, I think moves elected officials more than anything, is the how it benefits their community and their constituents and the people that it benefits. And then often I would recommend just doing a gut check if you're explaining the research that you're doing in a way that someone without a technical background, your neighbor next door, would be able to understand. That's sort of the level you're going for here. There has been a huge shift and huge trend towards ensuring that we are articulating the broader impacts of our research. So we really want to underscore that is very important. Elected officials essentially need that connection in order to sort of care at all about what we're talking about. So if you have local connections, honestly, that could just be that I work in your district. And I'm employed in the district, or I live in your district, or my patients, or the people who participate in my clinical trial come from these communities. Those types of impacts, I think, are really helpful. Certainly, the broader public health benefit to society is always helpful as well. The dollars and cents, like how many research dollars supported this effort, or the number of jobs in the lab that were supported, the trainees and students that are supported by a grant, anything like that you're willing to share really helps. And if your research is federally funded, which so much of it is from the university, we always want to make sure that we are also highlighting that and giving credit to the federal agencies. So thanking NIH, thanking NSF, anyone else who was involved in funding the research. Certainly, if there was also funds received from outside other sources, you can certainly reference those and mention it and give thanks and credit to them as well. But we do always want to underscore the federal funding connection, because part of what we're doing is sort of completing the two-way street of the transaction of sort of the federal science research partnership, where and from Congress's perspective, they feel like we are giving out all this money to federal to academic institutions, and we want to know sort of the benefit that comes back. And that's your participation in this process is really helpful to that end. So some examples as we go throughout here. Northwestern is a member of a coalition called United for Medical Research. The whole goal of UMR is to advocate for top line increases to the top line NIH budget. I happen to be serving as the president of UMR this year, so I did pull examples from them. We really believe they're a helpful organization. We at UMR, the membership is academic institutions, patient advocates, and industry members. So it's a really helpful when we talk about sometimes finding sort of bring a friend with you, someone else who can validate the importance of the research. Connecting to patients and to industry are really good ways to do that. So this is just one example of a fact sheet that we share with the Hill. This is one illustrating patient stories. So that's one way that, and I think that IFAM and NUCATS are in a really good position to kind of share those stories to the extent that you have permission to do so and you're willing to share. Another way to do it is sort of as I said, the dollars and cents or the economic impact. This is also data from UMR. You are certainly welcome to use this specifically. We've linked it here and it's on their website. They've parsed this data by state, and you can see the amount that and this is all NIH focused. So if that's relevant for you in the story you're trying to tell, how much money comes from NIH into the state of Illinois, how many jobs that supports, And then the economic activity, this is all done by an economist that is hired each year to analyze the economic impact of NIH funding. Okay, and so when you're timing your message, if you think back to the slide I showed with the sort of the calendar laid over the process, it's just helpful to think about the context in which you are advocating. Our office is always helpful to happy to provide that context if it's helpful to you. But there are certainly, issues that I'm sure you can think of in yourself. If the Supreme Court is considering cases that might be relevant to reproductive health, and you're on the Hill talking about women's health, like that might be something that you might want to acknowledge, even if it's not related to your work. Or keep in the back of your mind, like, what are other people thinking about when I come in and start talking about women's health? They might be thinking about these other issues that that come across their desk, might not be related to yours, but you can kind of think about if there's ways in which you want to acknowledge or just be aware about how your messages might be received, just given any political context. As I said, you can always be tying into some aspect of the appropriations process, because it's not ideal that there have been so many delays in the process, but we basically means that it's sort of always a funding time of year. So you can always be making the case for more funding, basically whenever you're advocating. And if, as I said, if there's current events that are relevant, you can just try to make some connections just to ground any conversation you're having. I think staff are always, when I think about Hill staff, often so inundated in their world is so shaped by what's happening societally around them that it's sometimes helpful to just have touch points, and it helps keep your message relevant. And so on the theme that advocacy is a team sport, as I mentioned in the example of United for Medical Research, we always try to think about who else cares about this research. Obviously, Northwestern cares. Obviously, we as researchers care. But is it the patient community maybe cares deeply about what you're working on? Perhaps there are community groups that support this effort. Maybe there is industry that you work with. Whoever that is for you, you might consider either just including their sort of feedback or their validation or their thoughts in your messaging that you share, or if they're interested in advocating with you. Zoom and the increased use of sort of telecom has sort of helped with that. It might be easier to convince someone to advocate with you on a Zoom meeting rather than like flying out here to Washington, although we're always happy to have you. That can be really helpful. In the case of UMR, I'll use as an example. When we go to the Hill for Hill meetings to talk about NIH funding and the importance of increasing it, we never go with just academic university participants. We always go with at least one member from the group from industry, and then at least one member who represents patients. And we have found that that is really helpful. And I think that it's not as recent anymore, but when NIH doubled the budget back in the 20 plus years ago, it was because of that sort of coalition, collective voice. No one messenger alone is going to achieve that type of outcome. So to the extent that you're able to do that, we really recommend it. And then again, this is something that we can help you with as you think through who you're meeting with, but we certainly recommend trying to make personal connections and maybe preparing to go into the meeting, knowing a little bit about the person you're going to talk to, and figuring out how you can make it relevant for them. In the example of Lauren Underwood, who's working on maternal health issues, obviously there's really it's very clear what she cares about, and so you sort of, for some members it's very clear, and how you can either at least acknowledge their interests or make connections between what you're doing and what they're interested in. For some it might not be as obvious, and we're happy to help you kind of figure out how you can maybe tailor your message. Some avenues to think that through is the elected official on certain committees. If it's a federal agency, like what is their exact portfolio, and have they written about their interests in sort of what they want to fund or what they want to work on? Are there just educational connections or personal background connections? A lot of times in this space, sort of disease-related advocacy can be helpful if they have personal connections from family or otherwise to certain diseases. That can be helpful touch points. You don't only have to talk to someone about the thing that they're interested in, but at least acknowledging where they are, I think goes a long way in building a rapport and making sure that you can have sort of multiple touch points in advocacy over time, so that you can be more effective. I think some of our most effective faculty colleagues are ones who have built relationships, who have established themselves sort of as the go-to person to talk to about a certain issue. And that does just take time. And so any personal connection points you can glean from your meetings can help you to kind of keep going back to that staff member or to that office and trying to build on the connection and build trust over time so that you can hopefully achieve your goals of whether that is increasing funding for something, having your evidence included in policymaking or otherwise. And then during the meeting, try to make it more of a dialogue, and hopefully they're willing to engage with you in more of a conversation rather than a monologue. That can be hard. Sometimes you'll only have about 15 to 30 minutes, is sort of an average length meeting if we're talking about the Hill. For federal agencies, maybe up to 60 minutes, depending on the staffer you're meeting with. But you don't have a ton of time, so you want to share your message and try to understand what they're working on that you can sort of plug into how you can help them achieve their goals, and then hopefully follow back up to kind of continue the conversation. We absolutely encourage that you have an ask. So this goes back to the very beginning of like, what is my goal? Try to articulate that from the beginning so that your meetings are working towards achieving that goal. An ask is basically a clear and actionable recommendation. I've included some examples on this slide. Again, whether that's increased funding, if you're looking to make policy changes, if you maybe are hoping that an agency studies something that you're interested in. If you just want to be a resource to them in a way that is an ask for them to consider you as a resource. So there's a number of different asks you can kind of articulate, and obviously they can change meeting to meeting. But you want to make sure that the staffer leaves the meeting knowing Caitlin Leach came to talk to me today about research that Northwestern is conducting in this space, and she's asking me to do something about it. Whatever that is, she's asking me to fund more research in this area. She's asking me to incorporate this data into a piece of legislation I'm working on. She's asking me to, direct NIH to study something new. Whatever that is, you want them to know what their homework is from the conversation. And so we recommend that you do a couple of things in terms of follow-up. So once you've had a meeting, definitely plan your next contact while you're still with them. So say, kind of say out loud what you're hoping to do next. So, confirm that you're going to send them the data that you discussed, or confirm that you're going to follow up with them to meet again in a month or so. Whatever the next step is, make sure you articulate that. We recommend that you bring some materials with you. So that could be IFAM materials or newscast materials, or if you have something specific about your data that you're willing to share. Wouldn't recommend it being super heavy and dense in sort of form. Would recommend something that's a little bit easier to read, perhaps more along lines of like a one-pager, or something to include graphics or other illustrations that can help break up the text. We can also help you think through what that would look like for you. You want whatever your leave behind is to speak for itself after you're gone. So to include your contact information, to include ways to contact you, to get more information, and to be clear about your ask as well. So you can incorporate that on whatever you leave behind. I do recommend that you can bring, if you are doing a physical meeting with someone, bring it in person, but then also send a copy electronically. And then obviously make sure that you say thank you when you're meeting them, but also follow up with thanks via email. And then that's a good way to kind of continue the conversation and have more build, your iterative advocacy with more contacts to follow. I know it can feel a little bit uncomfortable, but we definitely recommend practicing before you go. If you have a colleague or a friend who's willing to sit and listen to your spiel, that would be helpful. If you can practice introducing yourself, sharing your credentials, using that plain worded message to describe what it is you want to talk about, to emphasize sort of why they need to care about this through making the connections to broader impacts. That's very helpful. And then practice making your ask that clear, actionable recommendation. And you can always practice kind of the thank you part as well. Again, as I said, you'll have typically, if you're talking with someone on the Hill, no more than 30 minutes. So it is sort of a lot to fit in. And obviously, hopefully they'd have time to ask you questions and be really engaged. So you do want to try to condense what you're sharing. And then obviously, if they want more information, you can build from there. So definitely we can help you schedule meetings. We absolutely encourage you to connect with us before you do that. I know that Jennifer will reemphasize that as well. But honestly, the best way to start is to reach out, and we can help you find those contacts of who to reach out to. And then we see, I shared an example of a Hill Day that just happened last week, earlier this month. So definitely recommend amplifying your messages if there are associations that you're a part of, or your own your own social media. We recommend using that as an avenue to sort of say thank you, to share your message, to tag the members or the offices you met with. It's a great way to get that kind of message out and amplify the conversation. And I'll hand it back over to you, Jennifer, to close us out.
Great, thanks, Caitlin. We are happy to answer any questions that you might have. And I will just emphasize, it is definitely to your benefit to reach out to our office if you have any questions or concerns, or really do want to connect with your elected officials at the local, state, and federal levels. One of the reasons for that is sort of, as a private institution, we are governed by different tax laws and have to register as lobbyists and abide by different rules at the city of Chicago and the state of Illinois and at the federal level. So it's really extremely important to contact us if you really want to reach out and connect with an elected official. It's one thing to talk big, broad issue. There should be more NIH funding. That's sort of like community discussion. If you get down to more specific things where you're asking, I think elected official X, you should give Northwestern this money, that really crosses the line into lobbying. And it's best if you work with our team in our office, and either we can accompany you on those visits, or we can help you with your messaging if you do go out. The problem for us is that each level has different rules. So it can be difficult to manage as an individual, and we just encourage you to connect with us so we can help you manage those communications. And I saw that there was a question about Publix, and they are, Caitlin, maybe you can weigh in on this too, but essentially they are intergovernmental relationships. So public institutions are viewed differently under the lobbying rule at the state and local level than private institutions. So I hope that answered that question.
Yeah, and the only thing I would add to that is just that and we didn't include this, but maybe we could now to be helpful. Sort of the definition between advocacy and lobbying. There is a lot you can do that still falls under the umbrella of advocacy that really doesn't. That's more educational in nature. You're sharing information. You're making them aware of an issue maybe that you are tracking, or that you really think they should pay more attention to. It really doesn't cross into official lobbying, and that's what would have to be to trigger all of the reporting that Jennifer was just explaining. Once those are more specific, like as Jennifer said, I want you to fund something very specific to my institution, or I want you to take a certain action. So we can help you kind of make that call, because a lot of times it's never as black and white to kind of make the definition of advocacy versus lobbying, but that's probably part of it too, obviously. That goes into those who maybe have other affiliations that you might be mindful of. You have a lot of latitude in the advocacy space that's not lobbying.
And thank you again for the opportunity to chat with you.
Thank you, Jennifer and Caitlin. So you actually just answered one of the questions I was going to ask you about advocacy versus lobbying. So I think to that end, what is your kind of recommendation? And you spoke to this a little bit about, are there things we can't do or guidelines that we should follow when engaging elected officials?
I should also clarify that if you're doing it on behalf of your unit, your department, the university, you must work through the Office of Government Relations. There is actual policy on that. We're in the midst of updating it, but you can find that policy on our website under policy, under the policy tag. If you are doing it as an individual, as a person that has an interest in a piece of legislation, you can do that as long as you do not use university resources or university letterhead to make that point. So let's say you do research in diabetes, but maybe you're a parent of a diabetic child and you want to go with a diabetes association to go talk to someone. If you're sort of wearing your parent hat, you can totally do that. And, you know, you can even say that you're a faculty member at Northwestern, but you should clarify that you're speaking as a parent and as a patient advocate, not as a Northwestern faculty member. So I hope that makes a little bit of sense. I will say we're also going to be launching some additions to our government relations website where we will list out scenarios. And hopefully, if you have a question, you can go to the website and say, oh, no, I'm good. I can just, contact my program officer, or no, this sounds like I should contact government relations. So we can have more bright lines for you all to understand, because the only way I can describe it is that City of Chicago, State of Illinois, and the federal government have all different requirements for lobbying. So the best thing to do is just to reach out to us. I will say the other thing that we really appreciate is if you let us know if you want to invite somebody to campus, because we get a lot of requests for invitations to Senator Durbin, Senator Duckworth, and other members of the congressional and state delegation, and we have to manage those for the entire university. So we would like to know if you have that interest, and then we can get it to the scheduler, we can get it to the right person and try to make that happen.
Okay, we've got another great question here. So how do you approach advocating for work that is inherently political, such as access to gender affirming care or gun regulations, for example? Is there a way to craft your message that will land well with Republican lawmakers in this case?
That's a really good question. And I know that so much of healthcare actually really does fall into these types of categories. So I think in these types of cases, the best thing to do is to have the conversation in person, because there's so much, I think, that in the person-to-person connection that really bridges some of these divides that we feel in society, where people are disarmed when you're face-to-face. And so I think to the extent that it's possible to not do these over Zoom, that really does help, because I think it just, to the point of building trust, building connection, before you even are talking about your topic, I think that really does go a long way. So I would meet in person to the extent possible. And I think that you do want to tailor your message somewhat. You obviously you're not going to change your data or change the conversation whole cloth, but I think there are ways to, I think that I'll use the gun regulations, for example, just because we actually have faculty who work a lot in this, and we've been just recently talking about this topic, so it's front of mind. I think that there's ways to find common ground on the issue. So you might actually, that doesn't necessarily mean you both agree about everything, but to find the areas where you do agree, and to kind of let the data, let it be attempt to let the data guide the conversation. Not everyone is going to, that will have varying levels of success depending on who you're speaking with. But to lay out, like, here's what I'm studying, here's what the evidence is showing us, from a very neutral place. I think that those three things, meeting in person, finding the common ground to the extent that you can find something, there's always something to agree on, even if it's not the controversial topic. And whether that, even if it's as simple as like, we agree that we both want to improve our communities or something like that, you can start from there as a shared value, and then let the data, try to let the data guide the conversation. I think that that's going to be your best chance for success when it's something that is a more of a, controversial topic.
And I guess the other thing that I would add to that is that, again, we're very blessed with a wonderful Illinois congressional delegation. And, sometimes I describe us as living in a big blue bubble, and we don't have these issues that maybe our colleagues in Iowa and Indiana encounter. So maybe it's helpful to go in with a colleague from a red state so that that person can add personal stories from that person's state, because honestly, there's very few members of our Illinois delegation that would not want to hear about the great research we're doing in those spaces. It's really the folks in the red states that we have to worry about. So if you can, partner with a colleague, that might also be helpful.
Along those lines, you mentioned that there's going to be a really big need for us to advocate for an increase in federal research funding. And to that end, if our delegation is so supportive of biomedical research, what other suggestions do you have for us to serve as advocates for the biomedical research enterprise?
It's a great question too. So I think there's sort of a two-pronged approach there. I think that our folks in Illinois, like Senator Durbin, for example, who are fully on board with wanting more funding for research, they still need to hear from you, because they want to use your stories and your examples to sort of further their cause. So I think it is still helpful to go talk to the people who do care, to give them sort of like the latest updates and the most exciting, new things that we're working on. And especially the things that we will lose if we're not funding, sort of like the what won't I be able to, kind of continue to do along this line of research if I don't have more funds, that type of a thing. I think that's really helpful, sort of like ammunition for them as they speak with their colleagues. But then, as Jennifer mentioned, I think the best way to do it is to start to talk to like team up with people from other states, so that you can kind of build coalitions and to reach other members that are beyond our, sort of very helpful delegation. And your scientific societies or like disease advocacy groups or patient advocacy groups that you might be aligned with can probably be really helpful in this space, because they often are covering a lot of ground that you might not necessarily cover on your own as an individual. And they're always looking for people who are willing to kind of have these conversations, and are willing to sort of volunteer some of their time to advocate. So I would recommend, working through any of the associations that you might be affiliated with.
Great. So I'm going to ask those who have joined us today, we probably have time for one more question if you'd like to add that to the question and answer box. And in the meantime, what would you recommend for somebody who wants to get involved in advocacy work? Where's a good place to start if somebody has never done that before?
It's a good question. You're welcome to contact us, and we're happy to help you one-on-one. Going back to my previous answer, if you're part of a scientific society, a lot of times they will have like courses or structure in place that you can start to plug into to learn some of these skills and to practice them. So that's another avenue. But yeah, we're always happy to help you if you reach out, and we can learn more about what you're doing, and then we can help kind of give you some suggestions of where to go from there.
And I think too, you know, a really basic way to get involved would be to attend a town hall if your local member of Congress hosts them, and, you know, use that as a way to introduce yourself to that member. Usually there's some interaction and networking time there if you're able to. You know, to me, that's always a good way just to introduce yourself and make yourself known to that member and the staff that might be in attendance at a town hall, that you are an expert in such and such policy.
Great. Well, seeing as there are no more questions, I think we can end a few minutes early. On behalf of IFAM and NewCats, Jennifer and Caitlin, we'd like to thank you for joining us this afternoon, and for everyone else who was able to pop into this webinar. As noted, we invite you to contact Jennifer and Caitlin if you have any further questions, and look forward to seeing you again soon.
Thank you.
Thanks.